If you are over 40, these 3 annual tests could be the difference between catching a disease early or facing it in crisis. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at some of the 3 critical tests that you need to do as someone's above the age of 40 to be able to stay on top of your health. Why does this one matter? If you are 40, your body begins to change. And this is what happens. Your metabolism starts to go down. Your risk for heart diseases starts going up. And also cancers starts knocking at the door. This is very common, and this is the good news that I have for you today. 80% of the chronic diseases are preventable or manageable. And this happens if you are able to catch these diseases early, or even you are able to take steps to control them. For example, if you go for a test and it shows that you have prediabetes, you have a golden opportunity to change your lifestyle and reverse this condition completely with just lifestyle change. And if you need more tips on how to go about this, you can always register yourself with the Health Insight 360. We give you a personalized coaching system to help you be able to reverse prediabetes if you have it. So these 3 tests that I'm talking about are quick, they are affordable, and they are also life-saving. And they help you detect the silent killers before even symptoms show. So if you love your life, you love your family, your future, it is time to act. Do not wait anymore. So which are these critical tests that you need to be on top of? Your blood pressure, the cholesterol, and also the blood sugar. The number 1 cause of death worldwide: heart diseases. And guess what? It starts silently. And it takes a long time. So it starts possibly in your 40s. That's why you need this annual trial test. 1, you need to check your blood pressure. High blood pressure has no symptoms and increases your risk for stroke and also heart attack risk. Even myself as a doctor, if I don't get to do my blood pressure, I won't know that my blood pressure is rising. So the only way to get to know and take charge and control of your blood pressure, have it checked. In one of my previous videos, I've given guidelines on how to do your blood pressure the right way. Kindly check on it. Then the cholesterol test. If your LDL is high, then this leads to plaque buildup. And when we talk about plaque buildup, that is how a normal blood vessel looks like. Then we have a blood vessel that is completely blocked out. And this is what happens when you get a stroke or a cardiovascular event or a heart attack, or even blockage of the arteries supplying your blood supply to your feet. So they can easily get completely blocked. Then your blood sugar, or what we call the glycated hemoglobin. As your sugar gets high, it gets attached to your red blood cells. So the glycated hemoglobins check the percentage of red cells that have glucose attached to them. And if the value is more than 6, then you have a problem with your glucose control. So diabetes is a silent creeper, so catch it before it catches you. Just 1 test a year can help you adjust your diet, your lifestyle and avoid medication later. Why don't you take control? Then cancer screening. What are some of the critical cancers that you can be screened for? Colorectal and breast. Colon cancer and breast cancer are two of the most common cancers affecting people after the age of 40. So, but this is what most people don't know. They are highly treatable if caught early. Why not be that person who takes charge of their health? Colonoscopy or the fecal immunohistochemical test. Starting from the age of 35 or earlier if you have a family history of colon cancer helps you to make a diagnosis of colon cancer and take the necessary treatment on a timely basis. And in some of my previous videos I've talked about colonoscopy, and the good news about colonoscopy, it catches asymptomatic polyps that could be in your colon, and they can be removed before they turn into cancerous, and you solve the problem completely. Then we have a mammogram. This done every 1 to 2 years for women beginning from the age of 40. Helps detect breast early before there are any symptoms, and you continue doing the mammogram up to the age of 74 every 2 years. Of course, if you have a family history of breast cancer, because there is also a strong genetic association of breast cancer with the family and genetic issues, then get advice from your health provider. Remember, the information that we present here is for general information. So for personalized care and for guidance on specifics of you as an individual, you can always go see your health provider, or you can book a virtual consult on our overall on the Wellness Health Services website, or you can present yourself physically at the Wellness Health Services Medical Center in Machakos, Catalonia. So this screening test, they detect precancerous changes before they spread, or even before they become into cancers. And skipping them is not briefly, it is gambling with your life. And why would you want to do that? So then having a full physical and a personalized screening. So once a year, do a full body health review. What does this encompass? Doing your weight and your BMI. This is very important because if you have obesity, and one of the critical things to do is also your abdominal circumference, then excess weight has been associated with the hypertension, diabetes and prediabetes, and also we have the condition we call the metabolic syndrome. And if you reverse this, you are able to avoid these diseases and also avoid more than 13 cancers that are associated with being obese. And if you have issues with your weight and you want a personalized coaching, do not fail to reach us out and enroll yourself in the Health Insight 360 for a guided weight reduction program to beat your diabetes and hypertension and also beat obesity. Then you can do vision and also hearing screening, and you can also do a skin cancer screening whereby you have a medical or a health provider just go do a total body exam to check for unusual lesions on your skin, and then doing a pap smear or a prostate check. This is based on your gender and also your risk. So this is the time to talk with your doctor about your family history on some of the conditions that you might have been having as a family. Talk to your doctor about your mental health concerns, what lifestyle changes do you need to adopt, and any strange symptoms that you have been ignoring. So prevention is not just about early detection. It is building a long, strong, and healthy life. So what is the cost of waiting if you do not do this test? One, the saddest thing I've seen as a doctor is a preventable death, or a preventable stroke, or a preventable heart failure. A heart attack that could have been stopped, a cancer that could have been caught early, a disease that quietly stole a parent, a spouse, or even a friend. So do not take feeling fine to be equivalent as being healthy. Silent threats don't knock, they crash in. So if you are over 40, take this message personally. Book your checkup, get these 3 tests, share this video with someone you love, because the best health plan isn't complicated. It is being consistent. Subscribe to the Overall Health YouTube channel for more health tips that can change and save your life. Drop a comment. Have you done this test this year?